dear students. Hope you all are doing good. I, Dr. Ami Rawal, your original guru for dental anatomy and dental histology, is here with you to have discussion on previous year questions for your INI-CET exam, right? So, let's have a quick revision of some questions. Along with that, we will cover some important topics. Okay. So, let's start with our first question. Okay, Dr. Nandini, good evening. Good to see you all back after live classes. So, coming to our first question, which of the following is not true regarding the difference in primary and permanent dentation? Enamel and dentin thickness is less in primary teeth. Crown root ratio of primary dentition is less in primary teeth. Width of the occlusal table is less in the primary teeth. Cervical enamel rod is apically placed in case of primary teeth, right? Okay, so very good evening everyone. I think some of you have given the answer also. D, Preeti, Nanni, right? So you are correct. Here D is the correct answer. Rest of the options are not correct for primary teeth. Well, here it is asked not true regarding. So rest of the options are correct for primary teeth and the last option is not correct for primary teeth, as the direction of the enamel rods is different in case of primary teeth. So this type of question was mainly asked in our recent INI-CET exam, that was in May 2025. And again from this topic, same pattern question was asked in November 2017. So this question, this type of question was asked in previous year paper also in November 2017. And this is from May 2025, right? So a repeat of question from the same topic. Again, it was asked the difference between primary and permanent dentition only, and what is not correct for the permanent dentition. So here it is asked for primary dentition. So what will be the direction of enamel rods here? For permanent tooth, this is our permanent tooth. What will be the direction of enamel rods? Cervical and central parts of the deciduous tooth, it has mainly horizontal arrangement of enamel rods. That is horizontal arrangement of enamel rods in the cervical and the central portion. You can see here, I am drawing, it has horizontal direction. Then coming to the tip, it is going obliquely and then coming vertical. So this type of arrangement you can see, oblique and then straight. Okay. So this type of arrangement is seen in deciduous teeth. Horizontal for central and cervical portion and vertical and oblique for the incisal portion. Now coming to the permanent teeth, it is similar in case of permanent teeth also. Only difference is that in permanent teeth, there is apical deviation of enamel rods in the cervical portion. Most of you have doubt regarding the direction of enamel rods also. I've seen that in Telegram group also. So your doubts can be cleared here again. Here you can see in the cervical portion of the permanent tooth, the rods deviate from horizontal portion to the apical portion. To the apical portion. It is not horizontal. It is going apically in case of cervical end of the tooth. Okay. So understood? It is asked which is not true. So as the direction of enamel rods is not true in case of primary teeth. This cervical direction, in cervical direction, mainly the direction of enamel rods in case of primary tooth is horizontal, not apical. It is apical in case of permanent tooth. And same pattern question was asked in November 2017 INI-CET exam. So you can say that this difference between primary and permanent dentition is important. You get questions from this topic. Coming to our next question. This is also from our recent INI-CET exam. Cementum seen in resorption lacunae is it acellular afibrillar cementum, acellular extrinsic fiber cementum, it is cellular mixed fiber cementum, or cellular intrinsic fiber cementum? So what will be the correct answer here? Anyone? We have recently discussed also this question. Cellular intrinsic fiber cementum. Yes. Preeti and Nanni. Good. Cellular intrinsic fiber cementum. So what are the functions of cementum? Mainly cementum has three functions: anchorage, adaptation, and repair. Right? So repair is basically a function of cementum. And in this repair, we have two types: anatomic repair and functional repair. In anatomic repair, the resorption area will be completely filled with cementum. And in case of functional repair, a portion will be filled by cementum and rest of the portion will be filled by bony spicules. Right? So we all know that this repair is mainly function of cementum. And which cementum will be filled in the resorption lacunae? So it is cellular intrinsic fiber cementum. Cellular intrinsic fiber meaning this cementum has cementocyte cells. Cellular cementum, definitely cementocyte cells are present in this. If it was acellular cementum, then there would be absence of cementocytes here. But as it is cellular, presence of cementocytes. Intrinsic fiber, so they are not the fibers that are PDL fibers entering cementum. They are the fibers formed within the cementum. They are the fibers formed by the cells of cementum. So cementoblast cells will form fibers which are intrinsic fiber cementums. They are not Sharpie's fibers which are entering cementum from outside. They are the fibers which are formed by the cells within the cementum, cementoblast cells. So this cellular intrinsic fiber cementum is cementum having cementocytes as well as presence of the fibers formed by cementoblast cells without any insertion of PDL fibers. It is a type of reparative cementum. As we all know, repair is the function of cementum. And it is mainly rapidly formed and it is less mineralized. So it helps in repairing of resorption lacunae. Okay, coming to our next question. True about Langerhans cells. So this question is from May 2024 paper. Again, this is a repeat question. So you can see you are getting repeat question from previous year also. So solving PYQs is very important. This was asked in May 2024 and it was previously asked in July 2021 also. Again, it is asked 2 times, right? Only the language was different. It was asked which is immune cell. Which one of the following is an immune cell among the given non-keratinocytes? So the correct answer was Langerhans cell. Here it is asked what is true about Langerhans cell. Is it G-specific granules? Is it modified lysosomes in suprabasal layer, ATPase activity, or dendritic cell? Again, yes, Preeti, you are correct. D is the correct answer. Dendritic cell is the correct answer. So you can see you are getting question on non-keratinocytes. Two times. That is, you are getting repeat question on non-keratinocytes. So it is again an important topic which is from OMM. OMM is definitely an important topic, right? So Langerhans cells are what? They are non-keratinocyte cells. These non-keratinocyte cells are mainly of 4 types. Which are the non-keratinocyte cells in OMM? Merkel cells. So you should be thorough with all the cells, non-keratinocyte cells. Merkel cells, you can get MCQ on any one of them. Melanocytes, Langerhans cells, and inflammatory cells, lymphocytes, right? So these Langerhans cells are mainly immune presenting cells. They are antigen presenting cells. They are immune cells. So you can be asked which are the antigen presenting cells. Melanocytes mainly are associated with formation of melanin pigment, and Merkel cells are pressure receptor cells. So again an MCQ question can be asked which are the pressure receptor cells. So pressure receptor cells are our Merkel cells, which are present near the nerve fibers in the basal layer. And Langerhans cells are not present in the basal layer. They are present in the superficial layer. Okay. Anurag has a doubt. G-specific granules and Birpic granules are present in Langerhans cells. Birpic granules are characteristic feature of Langerhans cells, not G-specific granules. Right? So Langerhans cells are mainly present in the upper layer, superficial layer of the skin. Mainly they have rod-like granules which are Birpic granules. So G-specific granules is not the correct option. Birpic granules is the correct option for Langerhans cells. Okay. And they have a convoluted nucleus. So you can be asked an image-based question also. Can you see this? These are Birpic granules, rod-shaped granules present in Langerhans cells. So Birpic granules are present in which non-keratinocyte cells? Langerhans cells. Here you can see it is present in the superficial layer. So image-based question can also come from this non-keratinocyte cells. So we have discussed the function of Langerhans cells also. It is antigen presenting cells. So mainly it is involved in immune mechanism. Coming to our next question. Which of this is not formed from dental sac? Again, an important question from tooth development. Tooth development is again an important topic. You definitely get one question in any exam from tooth development. Okay. So is it pulp, is it alveolar bone, is it cementum, or is it PDL? What will be the correct answer here? It is asked not formed. It is asked not formed. So what will be the correct answer? Pulp. Okay. Yes. Preeti, Sada. Good. Yes. Pulp is formed from dental papilla. Yes. So you should be thorough with this chart, right? Tooth germ has 3 parts. Which are the 3 parts of the tooth germ? Enamel organ, dental papilla, and dental sac. Enamel organ, in enamel organ we have inner enamel epithelial cells that will differentiate into amyloblast cells, and this amyloblast cells lead to the formation of which structure, which hard tissue? Enamel. Dental papilla is involved in the formation of dentin and pulp, DP. Dentin, remember DP for dental papilla, dentin and pulp. Okay. And coming to our next question, dental sac, cap, CAP, cementum, alveolar bone, and periodontal ligament. So remember cap for dental sac. Cementum, alveolar bone and dental sac and periodontal ligament. So cap for dental sac. Yes, Nandini, good. Cap for dental sac. So this chart is very important. It helps you to memorize the formation, and this question definitely come in any of the exam, whether being your NEET exam, your INI-CET exam. So tooth development is an important topic. Which cells are involved in the formation of which hard tissue, that can come as an important MCQ question. Which part of the tooth gum is involved in the formation of hard tissue, it can come. Dental papilla gives rise to what, dental follicle gives rise to what. So this is very important. Coming to our next question. In developing dental papilla, zone of Will is it cell-rich zone, is it cell-free zone, is it odontoblastic zone, or is it plexus of fresh cow? What will be the correct answer here? Zone of Will. What will be the correct answer here? Anyone? Cell-free zone. Right. So which are the zones of pulp? Mainly we have odontoblastic zone, cell-free zone, cell-rich zone, and pulp core. So this is an image-based question. Yes. It is an image-based question, right? Here we can see the presence of odontoblast cells. Then we have cell-free zone. Then we have cell-rich zone and pulp core. So you can be asked an image-based question for this also. You can be asked to recognize the zone of pulp. So here we can see absence of cells. So definitely it is cell-free zone, which is also known as zone of Will. Yes. What is the function of this cell-free zone? It has no cells. It provides space for accommodation of odontoblast during the formation of dentin towards the pulp. So they help in movement of odontoblast. This space is mainly accommodated by the odontoblast cells. Okay. So odontoblastic zone mainly has odontoblast cell. Cell-free zone mainly accommodate the odontoblast cell during the formation of dentin. Cell-rich zone mainly has undifferentiated mesenchymal cells which differentiate into fibroblast cells. Pulp core, blood vessels, mainly nerves, fibroblast. Okay. Yes. Which of this is not a succedaneous teeth? Again, this is a repeat question. This question was asked in November 2023 as well as it was asked in July 2021. This is definitely a repeat question. Okay. So, which is not a succedaneous teeth? Here image is given and you have to identify which is not a succedaneous teeth. So, you can identify it without this image also based on the numbering 1, 6, 1, 4, 4, 5, 1, 3. Right? Okay. Pooja is saying A. Yes. 1, 6 is definitely our molar. So molars are mainly non-succedaneous teeth. So for this, you should know what is succedaneous teeth and what is non-succedaneous teeth. Yes, Preeti, Lavanya, HSD, Anurag. Yes, 1, 6. So succedaneous teeth are mainly the teeth which replace the primary teeth. Primary incisors are replaced by permanent incisors. So definitely they are succedaneous teeth, permanent incisors, permanent canine. Primary canine are replaced by permanent canine. Then we have premolars in case of permanent teeth. Premolars will replace molars of deciduous teeth. First premolar will replace deciduous first molar and second premolar will replace deciduous second molar. So after that we don't have any deciduous teeth to be replaced. So which are the remaining tooth? Molars. So definitely the molars are non-succedaneous teeth. So permanent molars are mainly non-succedaneous teeth. This non-succedaneous teeth arise from distal extension of dental lamina. This we had discussed in our tooth development topic. So again, this can come as an MCQ question. The non-succedaneous teeth arise from which extension of dental lamina? So they arise from distal extension of dental lamina. And succedaneous teeth arise from which extension of dental lamina? Anyone? Succedaneous teeth arise from lingual extension of dental lamina, which is known as successional lamina. Lingual extension. So non-succedaneous teeth from distal extension, succedaneous teeth from lingual extension. That is successional lamina. So here coming to the options, yes, it is 1, 3 is definitely which tooth? Canine. So it is a succedaneous teeth. This is not the correct answer. 4, 5. This is again premolar. This is also not correct for. This is also a succedaneous teeth. Here it is asked which is not succedaneous teeth. 1, 4 is definitely a succedaneous teeth. So the remaining option is 1, 6. So this was also a repeat question in 2023 as well as in 2021 it was asked. So you can see till now we have 3 questions which are repeated from the same topic. Which of the following is seen in aging pulp? Increased fibers, increased cellularity, increased vascularity or decreased calcification? What will be the correct answer here? Increased fibrosis is mainly associated with aging pulp. Cellularity mainly decreases with age in pulp. Volume of the pulp mainly decreases. Cellularity decrease. It doesn't increase. Vascularity, number of blood vessels also decreases with age. So this is also not correct. Calcifications increase with age. So this is also not correct. Even the size of the cell decrease with age. Cell organelles decrease with age. Right? So only the fibers are increasing with age. We have increased fibrosis in case of aging pulp. Okay. Coming to our next question. Function of dental sac. Is it dental pulp develops from it? It decides the shape of the crown. It surrounds the developing tooth gum and provides nutrition. It provides the follicle eruptive force. What will be the correct answer here? What is the function of dental sac? Definitely, as we have discussed in our previous question, dental pulp doesn't develop from dental sac. It develops from dental papilla. So A is not the correct answer. It doesn't determine the shape of the crown. This is also not the correct answer. Yes, it can provide nutrition to the developing tooth gum. In which stage? But initially, the tooth gum will be getting nourishment from dental sac, or it is getting nourishment from some other structure. From which structure initially will be our tooth gum getting nourishment? Anyone? Yes, C is the correct answer here. But this nutrition is from dental sac during advanced bell stage. In remaining stages, a tooth gum is getting nourishment from which structure? What will be the correct answer here? Initially, again this is an important MCQ question. Initially, the tooth gum is getting nourishment from which structure? Yes, HST. It is dental papilla. Until there is formation of dentin, that is hard tissue, until the first layer of dentin is deposited, our tooth gum will be getting nourishment from dental papilla. Once dentin is formed, then what will happen? There will be cut off of the supply from dental papilla. Nutritional supply from dental papilla will be cut off after layer of dentin is deposited. Initially, it was getting from dental papilla. But once dentin is formed, nutritional supply will be cut off. Now it will require nourishment from somewhere. So then it will get nourishment from dental sac or dental follicle. Here we can see there will be degeneration of stellate reticulum cells, and here we have outer enamel epithelial layer which was laid down in folds to provide proper nourishment to our inner enamel epithelial cells. Okay, so initially from dental papilla and then from dental sac, and this dental sac will provide nourishment to the cells with degeneration of stellate reticulum, and the outer enamel epithelium will be laid down in folds so that nourishment can properly reach the cells. Right? So dental sac is also very important, but it is mainly active after advanced bell stage in providing nourishment during the advanced bell stage. Calcification of primary teeth starts by what age in intrauterine life? Calcification of primary teeth, it is asked. Here, this chart is very important. You should be thorough with the eruption timings of the primary and permanent teeth, as well as initial calcification. You should definitely know this answer. 13 to 16 weeks. Yes. 13 to 16 weeks. Yes. So, this is the correct answer here. This chart is very important for chronology point of view, primary teeth, permanent teeth. You should know the eruption timings also. You can be asked image-based question also, right? So, this is very important. Eruption timing of primary as well as permanent teeth. Okay. Now coming to our next question, which is a numerical type of question. Ratio of width is to height of the crown of permanent maxillary central incisor is it 0.4, is it 0.8, is it 0.6 or 1? So for this, you should know what is height and width of the tooth, right? Height of the tooth is what? This is cervical portion, this is incisal portion, right? Incisal, cervical, or this is the height. Cervico-incisal length of the crown. Okay, all of you have already calculated, I think. Pooja, HSD, Sada. It is 0.8, okay. So height is what? This is the height of the crown. Cervico-incisal length of the crown. And what is width? Mesiodistal dimension of the crown. This is the mesial surface, this is the distal surface. Mesiodistal width of the crown is our width. So width is mesiodistal dimension. Height is cervico-incisal dimension. So mesiodistal is 8.5, cervico-incisal is 10.5. So ratio of width to height is 8.5 divided by 10.5, that is 0.8. So the correct answer here will be 0.8. Right? Now coming to our next question. What is seen between newly formed cementum and resorption area? Is it incremental lines of Salter? Is it reversal line? Is it striophragzius? Or is it line of Hope 12 Smith? What will be the correct answer here? So incremental lines of Salter. These are incremental lines of cementum, right? They depict successive deposition of cementum. They're not formed between the resorbed area and the newly formed cementum. They are depicting successive deposition of cementum. So this cannot be the correct answer here, right? Coming to reversal line. Reversal line is the correct answer here. It is a line that is present between the resorbed area and where new cementum is being deposited. Striophragzius. What is striophragzius? It is incremental line of what? Striophrezius, incremental lines are very important. Incremental lines of enamel, incremental lines of dentin, incremental lines of cementum. You should be thorough with this incremental lines. So, incremental lines of, what are striophrezius? They're incremental lines of enamel. So here it is asked for cementum, so this cannot be the correct answer. Layer of Hopewell-Smith. Yes, HSD. Layer of Hope, it is line of Hopewell-Smith. Basically, you have layer of Hopewell-Smith. It is other name for intermediate cementum. Intermediate cementum is also known as hyaline layer of Hopewell-Smith. Right? So, hyaline layer of Hopewell-Smith is also known as intermediate cementum. This can also come as an MCQ question. What is hyaline layer of Hopewell-Smith? It is intermediate cementum. So the correct answers among the given option is reversal line. Intermediate cementum mainly has neither characteristics of dentin nor cementum. Coming to a next question. Type of collagen present in dentin. So what will be the correct answer? Now, same question was again asked in, this is a question from 2023 and May 2023, and again it was asked in 2019, initially in 2019 and then in 2023, same question, right? So this is also a repeat question. Which type of collagen is present in dentin? So again, we have discussed 3 questions that were repetitive. Type 1 collagen. Mostly, we have 90% we have type 1 collagen in dentin. We have type 3 collagen in dentin also. In which type of dentin we have type 3 collagen present? Can anyone answer this question? Type 3 collagen are present in which type of dentin? Yes, Sujay, HSD, Nanni, Sada, Anurag, and even Pooja. What will be the correct answer for type 3 collagen? Preeti. Type 3 collagen is mainly present in mantle dentin. It is mainly present in mantle dentin. Yes, Bhumika, good. They are bone corpse fibers. Yes, HSD, Anurag, good. Von corpse fibers. So they are mainly present in mantle dentin, and these fibers are agrophilic fibers. Very good. So type 3, you should remember, they are von corpse fibers and they're present in mantle dentin. Mostly we have 90% type 1 collagen in dentin. Yes, Anurag, good. They are agrophilic fibers. Okay. Now coming to our next question, which is from DA. Sequentially arrange in correct order of eruption of permanent tooth in maxillary arch. So what will be the correct answer amongst the given option? Central incisor, lateral incisor, first premolar or canine. Now this sequence is correct, but we should read the other options as well. So don't come to conclusion after reading only first option. First, go through all the options and then decide the answer. This sequence is correct, but in relation to other option, you should write your answer. So coming to our next option, first molar, central incisor, canine, lateral incisor. First molar, central incisor, lateral incisor, canine. or first premolar, central incisor, lateral incisor, and first molar? What will be the correct answer here? Yes. So all of you are getting it correct. First molar, central incisor, lateral incisor, and canine. As first molar is also given here, so option C is correct. If first molar would have been absent from the option C, then option A would have been the correct answer. Right? Yes, Akash, you are also correct. C and A both are the correct answer, but more apt is option C here, as first molar is also given. If first molar would have not been given here, then you can opt for option A. But basically, A and C both are correct here. But more apt is C here. Yes. HST is correct. He has given the sequence also for maxillary arch. So we have first molar, then we have central incisor, then we have lateral incisor. Then we have premolar, not canine for maxillary teeth. First premolar, then you can have canine. Then you can have second premolar, then second molar, and then third molar. Or you can have first molar, central incisor, lateral incisor, first premolar, second premolar, and then canine. So canine can come before second premolar, but after first premolar, or it can come even after second premolar, right? So you should be thorough with this sequence. First premolar comes before canine. Canine can come before or after second premolar. For mandibular, it is first molar, central incisor, lateral incisor, then canine, not premolar. Canine, first premolar, second premolar, and second molar. Understood? So again, this chronology table is very important. This eruption timing is very important. Here you can see first molar, then central incisor, then lateral incisor, then first premolar, then second premolar or canine, and then second molar. Same for mandibular teeth. First molar, central incisor, lateral incisor, canine, first premolar, second premolar, second molar. So you should be thorough with this table. Even you should know, it can be asked which tooth calcifies at birth. So it is first molars. We had a question for primary tooth, right? Initial calcification starts at which weeks? Same way you can be asked calcification at birth for which teeth? Permanent teeth. So it is definitely first molar. Coming to our next question. Extension of dentinal tubules in enamel are called. Are they enamel spindle? Are they enamel crack? Are they dentinal tubules? Or are they secondary dentin? What is the correct answer here? Enamel spindle. Yes. Akash, HST. It is enamel spindle. Enamel spindle, you can see here, they are extension of odontoblastic processes in enamel. They cross DEJ. This is our dentino-enamel junction. These are our dentinal tubules having odontoblastic processes. These odontoblastic processes cross DEJ and enter enamel. These structures are our enamel spindles. So you can be asked image-based question also. Identify the structure marked with an arrow in the given image. So this structure is our enamel spindle. Yes. So mainly they are extension of odontoblastic process in enamel crossing dentino-enamel junction. Okay, so all of you are correct here. Which of the following is not true about CEJ? Enamel overlaps cementum, dentin overlaps cementum, cementum overlaps enamel, edge to edge junction between enamel and cementum. So we all know that basically there are mainly three types of cemento-enamel junction. Three types of cemento-enamel junction. One is sharp type, that is edge to edge. Butt joint, it is also known as butt joint, right? Then we have overlap junction. Overlap meaning in cementum overlapping enamel. Okay. And the last is gap junction, that is the gap between enamel and cementum. So in this diagram, you can easily identify the black portion is our enamel and this is our cementum. Right? So you can see cementum overlapping enamel. So here, this is correct for CJ. So this is not the correct option for the given question. Cementum definitely overlaps enamel. Edge to edge is also a type of CJ. So this is also not relevant with the correct fit with the question. Now between A and B, you might have doubt between A and B. Dentin definitely is not overlapping cementum. So B is the correct answer. But why not A? In odontogenesis, usually enamel never overlaps cementum, but it might be in 0.5% of the cases that it may be present due to artifact. It may be present due to artifact. So it is present only, right? Maybe due to artifact, but it is not a part of odontogenesis. It is due to artifact during processing. So it may be sometimes present, enamel overlapping cementum. So the correct option here is dentin overlapping cementum. Okay. It was a question in November 2018. This question is from November 2018, INI-CET. Okay. So we can discuss about cemento-enamel junctions. Why overlap junction is present? We all know that when tooth is formed, it is mainly covered by reduced enamel epithelium. This protects the tooth from surrounding dental sac. So when there is a retraction of reduced enamel epithelium near the cervical portion of the tooth, this dental sac cells come in contact with the formed enamel. This dental sac cells differentiate into cementoblast cells, leading to the formation of cementum over enamel near the cervical portion, where there is retraction of reduced enamel epithelium. So this overlap junction is mainly present because of retraction of reduced enamel epithelium. Coming to next, which is edge to edge. It is present in 30% of the cases. Mostly this overlap junction you can see in 60% of the cases. Gap type. Why gap type is there? Mainly HERS is involved in the formation of cementum, right? If there is disintegration of HERS, then only the dental sac cells can come in contact with the formed dentin, leading to the formation of cementum. But if there is no disintegration of HERS, definitely, so right, this is HERS, which is having only inner enamel epithelial cells and outer enamel epithelial cells. Here we have dental papilla cells, which will lead to the formation of dentin. So this HERS will disintegrate, and here we have dental sac. So when this will disintegrate, dental sac cells will come in contact with the formed dentin, leading to the formation of cementum at a proper time. But if there is no disintegration, there will be no formation of cementum, right? So this gap junction is mainly present because of delay in disintegration of HERS. So always remember, overlap because of retraction of reduced enamel epithelium, and gap is mainly present because of delay in disintegration of HERS. Yes, 10% is non-overlap, that is gap junction. Okay, coming to our next question. Identify the type of molar cusp in the given picture. So this is an image-based question. Here we can see 3 cusp pattern, right? 3 meaning tri. So is it triconodont? Is it haplodont? Is it tritubercular or is it quadritubercular molar? What will be the correct answer here? These are types of what? Phylogenetic classes of the teeth. These are mainly phylogenetic classes of the teeth. There are 4 phylogenetic classes of the teeth. Single cone, 3 cusp in a line, 3 cusp in a triangle, 4 cusp in a quadrangle. So what will be the correct answer here? Tritubercular is the correct answer here. Yes. Here we can see 3 cusp. So this is tritubercular. Triconodont is what? 3 cusp in a line. 3 cusp in a line. Here you can see. Three cusp in a line is triconodont, and here you can see 3 cusp in a triangle. So here definitely we have 3 cusp in triangle, not in line. In line it would have been this. So triconodont is not correct and tritubercular is correct. If it would have been in 3 line, right, then triconodont would be correct. But as it is in triangle, tritubercular molar is correct. Haplodont is single cone. 3 cusp in a line is triconodont. 3 cusp in a triangle is tritubercular, and 4 cusp in a quadrangle is quadritubercular. 4 cusp in a quadrangle. Okay. Coming to our next question. So we have an image-based question from Chronology. Mostly this is also repeat question. This Chronology question definitely comes. Identify the age of the patient based on the following image. So, okay. Is it 7 years? Is it 4 years? Is it 2 years? Or is it 3 years? What will be the correct answer here? Basically, our primary dentition develops between 2.5 years till 2.5 years, right? Here you can see that this blue teeth are our primary teeth. So all the primary teeth are present here, and none of the permanent teeth have yet erupted. Can you see any permanent teeth erupted? This white teeth are our permanent teeth. Even first molar have not yet erupted. So what will be the correct answer here? Yes, Akash. Good. Lavanya. Anurag. Anurag, why 7 years? Here 4 years will be the correct answer. If incisors would have been erupted, then it would have been 7 years. But incisors have not yet erupted. We have primary incisors. So B is the correct answer here. As all the primary teeth are present, including the incisors, and no permanent tooth have yet erupted, from the given option, our best option is B, that is 4 years. If incisors would have been erupted, then you would have gone for other option, right? Okay. Again, an image-based question. In the following image, labiolingual, mesiodistal, cervical, and mid-root section of which tooth are seen? So, is it maxillary permanent central incisor? Is it maxillary permanent lateral incisor? Is it mandibular permanent central incisor or mandibular permanent lateral incisor? What will be the correct answer here? Anyone? So first you should go through the image, right? You can see it is mesiodistally wide. Yes. One edge is sharp, one edge is rounded. Mesioincisal edge will be pointed, distoincisal will be rounded. So permanent maxillary central incisor is the correct answer here. Yes. Otherwise, you can see for lateral incisor, it would have been slightly mesodistally less as compared to maxillary central incisor. Okay. Coming to Nolla stage. Stage 7th of Nolla shows 2/3 of the crown complete, 1/3 of the crown complete, 1/3 of the root complete, or 2/3 of the root complete. This you might have studied in your periodontics also. So what will be the correct answer here for 7th stage? 1/3 of the root complete or 2/3 of the root complete? What will be the correct answer? Okay. So I think all of you are thorough with this 1/3 of the root complete. This stage is also very important. Initially, you can see absence of crypt, then crypt will be present. Initial calcification will start. 1/3 of the crown will be completed. 2/3 of the crown will be completed. Crown will be almost completed. 100% of the crown will be seen. Then we have 1/3 of the root completed. Then we have 2/3 of the root completed. 2/3 in stage 8. Root almost completed with root apex in stage 9. And stage 10 is root apex completed 100%. Okay. Now coming to a last question. Alternate light and dark bands seen in the tooth cross section are known as, are they Hunter-Schreger bands? Are they incremental lines of Retzius? Are they neonatal line? Or are they reversal line? What will be the correct answer here? Coming to a last question. Alternate light and dark bands, it is asked. Okay, it is definitely Hunter-Schreger bands. They are light and dark bands. Alternate light and dark bands are mainly Hunter-Schreger bands. Okay. So it was a nice session, a very interactive session with you all. Enjoyed this session, and we have tried to complete the important topics also. Cemento enamel junction we have discussed, tooth development we have discussed, right? Pulp zones we have discussed. Dentin also we have discussed, primary dentin. Chronology portion. Then we, right? Even tooth numbering system is also very important. Neonatal line is mainly accentuation of incremental lines. It is a difference between, it differentiates between prenatal and postnatal enamel. Postnatal is formed after, prenatal is formed initially, before birth, and postnatal after. Prenatal enamel is mainly of better quality as compared to postnatal enamel. Okay, Sada? Okay. So, thank you. It was a nice session. Good night. And light and dark bands. Yes, we had discussed about light and dark bands, right? Diazones is light band or dark band? An angle between diazone and parazone is 40 degree. Okay. Thank you. Good night.